Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call her Yara Greyjoy. Yara has a blockage of wax on both sides, and she is someone who wears hearing aids, and she notices that when she can't hear so well from the hearing aids that it's time to have an earwax removal carried out. We are beginning with the right ear, quite golden wax, which means it's quite new and it has been pre-oiled. When I begin the suction, you can see that the ear canal is quite narrow. So when the probe goes in, it wants to suction the ear canal skin on its way into the ear canal. Due to the narrowness of the ear canal, the ear is now being held open, and you can see the difference that makes to the view I have of the wax and the space that the endoscope and the probe have in the ear canal. And those surface pieces of wax are being suctioned in. There's quite a big skin amount that went into the probe there. I'm gently suctioning, then pulling away to dislodge the blockage. When the probe releases the wax, you can see just how connected the whole blockage is. And after some more suctioning and tugging of the earplug, I decided here that we needed oil. So now I've saturated the blockage with oil, and I'm using the wiggling motion while suctioning, and you can see it's finally being released. And a sizable piece, which is very shiny due to the oil, and it is dark compared to the wax I removed at the entrance, which means more oxidation has taken place over time with it being in the ear and slowly being pushed to the back of the ear canal. So we definitely know that that's older because it's deeper down and it's darker in colour. And there we have a side view. And as I go back in, you can see that there's still some wax remaining in the ear canal. This wax does look a lot more stickier. It's wetter as well. And as I remove the residue and the areas around the periphery, suddenly you can see here that a pimple has been revealed at the top of the ear canal. And it is quite big and it is soft, which is what makes me think it's a pimple rather than a bony growth of some sort. It hasn't caused any discomfort to the patient because sometimes even a tiny pimple in the ear can cause a lot of pain for patients. And here I've removed what looked like just a small amount of residue in the ear has turned out to be quite a large piece of wax. And here's a view from the other side. And here is a final shot of the right ear. I did refer Yara to her GP for the pimple and just this very yellow area here on the eardrum for precautionary measures. It almost looks like she has two what we call umbos, which is where the malleus bone behind the eardrum attaches to the centre of the eardrum. And it looks a bit yellow, just looks a bit off, but it may just be the pattern of the capillaries on the eardrum which made it look more prominent, because it almost looks like it's bulging out. But the doctor did examine the ear post-procedure and said everything looked okay, so she was given the all clear. There is still some waxy residue in here, but this was left for patient comfort. And of course we have the pimple also at the top of the screen as we are retreating from the ear canal. Now I'm going over to the left ear. This has been oiled. Immediately we have a translucent keratin layer coming away, followed by the blockage attaching to the end of the probe. And you can tell again this is quite a large piece, and unlike the other ear, it's come away in one go. Very satisfying and obedient wax as well. It listened to what I wanted. So here's the still. Makes you realise and appreciate just how big this piece of wax was. And here is a final shot of the eardrum. Very beautiful. Not red like the right ear, and in this shot as I'm going in, I'm trying to avoid the endoscope touching the soft hairs as it's going into the ear canal, so I can get a super clear picture of the eardrum. And look how beautiful it is. It's very nice on this side. Thank you so much for watching episode 28 of Wax Off. This week feels like a much shorter one in comparison to episode 27. I hope you're enjoying my videos. We're trying to build a community of our own within the earwax removal world, so please do keep subscribing and commenting. If you do have any questions, please do comment in the comment section below. And it's peace out from me, and I will see you in the next one.